Hi, everyone. I'm Rashida, your fave CRA, and I'm excited to have a special guest on today. Before we get into that, I want to talk about why I created this YouTube channel. So I've been in the industry for a little over 10 years now, and I created this to be a space for anyone seeking more information about the clinical research industry, how to navigate a career as a CRA, and ways that you can set yourself up for success. This channel is not just for people who have plans to become a CRA. It's also for anyone who wants to get insight into the industry and what our work as clinical research professionals entails. So today, I have Ashley on with me, and I'm so excited to have her on here. I'm going to say why I asked her to come on here. So, we're part of a group called Black Women in Clinical Research, and Ashley put up a post, and I'm going to read a little bit of the post because it struck a little piece of my heart. And I think a lot of people think that becoming a CRA is all about the money and you just, you travel and this is a whole nother life, but you have to understand that clinical research on the beginning part of it is about the patient. And you have to have certain skill sets. It's not an entry level role. So I'm going to read what she said. So she says, I never understood when people would tell me CRAs aren't an entry level position. I thought if I had 1 year of CRC experience, I should be able to learn the ropes. Meanwhile, 6 years later, with 6 years of CRC experience and now a CRA, let me tell y'all, if I didn't have the 6 years under my belt, I would be sinking right now. So thank you for saying that. And I really want to get into this because you were a clinical research coordinator and you transitioned recently to being a CRA. So welcome. Welcome to the club, girl. You are officially a road warrior. So I would love for you to kind of give me your background, your education, your work experience, and then we'll kind of go from there.
So thank you for having me, first of all. So I started off wanting to be a doctor. I grew up around physicians. My stepmom was a physician, so I thought being a doctor was exactly what I wanted to do. So I went to Tuskegee University and I majored in biology. I did my 4 years there. I then moved to the Dallas area. While I was at Tuskegee, I actually went to a career fair and they were hiring for, it was at the VA hospital. And so I got hired for a canteen manager, which is like over the food and the stores and all that type of things. So I thought that would be a good way to kind of navigate my way into the healthcare world. So I would purposely work at Starbucks in the morning so I could see all the doctors. And I just kind of was like, hey, I have a biology degree. If you guys are hiring, hire me. And one day a doctor actually was like, hey, I actually have a position in research. So I said, oh, okay, cool. Tell me more about it. So when I heard research, I thought the lab. So I interviewed for the position. I started working there. And after that, I just really fell in love with research. It's really one of those things that's never introduced and it finds you. And so that's kind of how that worked.
Awesome. So I love that you purposely worked at Starbucks. You were like, I'm going to connect myself to a doctor. Kudos to you. So when you were in research, was that clinical research that you were helping out with the physician?
Yes, so it was clinical research in infectious disease.
Okay, and what was your role there?
So my role there was a research coordinator. And then I transitioned to another institution and I became a CRC.
Okay, so what were your responsibilities as a clinical research coordinator? And I'm asking because even though my background was a coordinator, a lot of my experience wasn't hands-on. I did have a few positions where I was consenting patients, but then as I got closer into oncology, where I started at Vanderbilt, it kind of separated it out. So we were siloed. So we were considered clinical data managers, and then we had a regulatory group, and then our research nurses were the actual ones who were around the patients a lot. So what were some of your responsibilities as a coordinator?
So I also worked in oncology as well. That was, I say, my biggest part of my learning curve. Oncology is very hard.
Yes.
Those protocols are very long. So knowing how to read those protocols really, really helped. So some of the duties as a CRC in oncology, I would, of course, consent the patient, tell the patient, of course, what the study is entailed, work with the doctors to recruit patients, making sure we're looking at who's coming into the clinic today, who can we talk to, are these people that will be a good fit for the clinical trial? So we're screening the patient, then we're consenting the patient, and of course, in oncology, it's very important because the majority of the times these people were just now finding out they had cancer that day. So you had to be that person who kind of gave support, gave them options. So I always say it's kind of like you're a little social worker as well, because they really lean on you for support. After that, you're getting that patient enrolled. So you're dealing with sponsors, you're dealing with scheduling. A lot of these patients need x-rays or they need biopsies. So these are things that we kind of had to schedule and work with different teams as well.
Yeah, that's a lot of coordinating.
Yes, a lot of coordinating. You are the middle man. So building those relationships with all the different departments came in handy. You're also watching that patient throughout the whole process, making sure if they have any serious adverse events that you're keeping up with that patient and following the protocol to a T and making sure you're not, deviating from the protocol. And the list goes on. So you're just that middle person.
Okay, so with all of that, and it sounds like you actually really enjoyed being a coordinator, what made you want to transition, or was there some kind of opportunity that came up that you wanted to transition from being a coordinator to a CRA?
So originally, the reason why I posted that post that you were referring to is because I was one of those who was like, oh, I got a year of experience. If I know what I'm doing here, then I should be able to be a CRA. And I would always get denied when I applied. And I just didn't understand why I was being denied with only 1 year of experience. I wanted to be a CRA during this time because I thought it was a very, very good opportunity. I actually saw one of my old coworkers post on LinkedIn that she had gotten a new job as a CRA. So I hit her up on LinkedIn and was just like, hey, can you tell me more about that position? And then it was history ever since. So it really went pretty fast.
Yeah. So the industry is really booming right now. And I will say, like, even though we know that now that you're a CRA, you understand that there's lots of background information and lots of things that you have to have in you with experience in order for you to be a good CRA. I want to also say that just because you only have 1 year, 2 years, doesn't mean you can't be a CRA. It's just the transition period can be a little tough if you don't have that base of clinical research knowledge and or working with patients and or sites. So thank you so much for bringing that up. What was your experience with monitors while you were on site? Was there any pull from them to say, hey, come onto this side?
So majority of my CRAs were very experienced. They have been in the industry for a very long period of time. A lot of them were actually regional, so they really didn't have a lot of travel. They were mostly in the area. So for them, they were like, you should definitely be a CRA, but this is what comes along with it. So, when you hear, oh, I like to travel and you really don't get it until you become a CRA. So I would say, those are the little tidbits that they would say while on site.
Okay. Well, what do you think helped you land the role? So you said that you reached out to an old coworker who had transitioned recently and kind of asked her questions, but what other things do you think helped you in transitioning?
So I definitely think networking is number one. I have a mentor that is a senior CRA. I talk to her all the time. I ask for advice. How should I, market myself? How should my LinkedIn look? Is my resume okay? Having that mentorship is a whole nother level. It really gives you an insight on how to move forward, as well as putting yourself out there. I know that is a little hard at times to just say, okay, I'm going to send somebody a message, but it's definitely worth having. So networking is key. As they say, your network is your net worth. So that
Yes.
is a true statement.
It is. And you're right. It can be very nerve-wracking to reach out to somebody on LinkedIn, especially if you don't have a rapport with them or you don't know them. And so what I always suggest is if it's your first time reaching out to somebody, don't just go straight into it. Introduce
Of
yourself,
course.
maybe put a little bit of information about your background, what you wish to kind of get out of it. So say, I saw this position, really wanted to know if it's still available, even if you know it's available. It's just a way to kind of break that ice and build something up with someone. And I always say, if you can write a message and they respond back to you, the next thing you can do is get them on the phone call because that really builds relationships.
Yeah.
So did you talk to any recruiters in that time period?
So, like I said, my process went very fast. I interviewed for 4 different positions at the same exact time. Um, and so it was like recruiter after recruiter. So I did speak with recruiters on the phone. I have to say the recruiters were it was harder than the interviews. They asked a lot of deep questions. So coming in, I thought a recruiter's job was just to see what's your background and okay, move you on to the next. But no, they asked a lot of tough questions. They really do they're in the process of interviewing you before they send you on to the next step.
Yeah, they definitely try to vet you out and make sure that whatever experience you have on your resume, you can actually speak to it because they know that those questions may get asked at the next level, so they want to make sure that they have a really good candidate to introduce, to somebody. So once you transition, what were some of the skills that you think helped you as a coordinator be a good CRA?
So I have to say, being a good time management, and as well as being able to multitask. As a coordinator, I could be going to go consent a patient, but then the phone rings and I'm like, oh, you had an SAE. Okay, you have to kind of navigate that time space on how you planned your day versus how things are just going to come about. As being a CRA, I can definitely say that has helped, from emails to phone calls from sites to actually being on site and another site calls. So you really have to be able to juggle a lot of things and be very organized.
Mm-hmm.
Organization is the key.
And what
So
has been one of the more challenging parts of your transition?
organization. I thought that I was great at being organized, staying to my calendar. Well, let me go back. I was not a person that followed my calendar. Not at all. I just went by day. As a CRA, I am checking my calendar at night. I'm like, hey, what time do I need to be up tomorrow? Because your day to day duties change,
Different.
and then working with people from different countries, their time difference. So I may think, usually I'm starting at 9, but I have a meeting today and it's at 7. So really staying on top of your calendar is one of the things I kind of struggle with.
Are you at that point now where you feel more comfortable with your calendar and you're able to kind of, because what happens is you have your calendar, right? And I'm a person who I actually have a paper calendar. I'm a little old school in that part because I like to see this landscape view, and I usually use a pencil because there are some times where you'll schedule a visit and then it changes or they move it. And so what do you use as your go-to calendar? Do you use electronic or paper or a combination?
So I use both. So I have my Outlook where I kind of keep everything organized there as far as travel. It really helps me to know what time my flights are leaving. But I'm also old school and I like paper. So I like to touch, feel, see.
Mm-hmm.
So I kind of work with both. Another thing that I created is a notebook with the 7 subjects. And it allows me to keep all of my studies and sites kind of organized to keep up with what's going on. So
Yeah.
it's just a learning process of
Yeah.
trying to figure it out
It
and what
sounds
works.
like you're working your way through it though.
I'm trying. I'm
And
trying.
so that's the most challenging part to you. But what is your favorite part so far?
My favorite part, I would have to say travel. Love to travel. People who know me know that I am planning trips all the time. So being able to, my family's going to hate me after I say this, but being able to have that little break in between,
Yes.
it kind of
Yes.
refreshes the mommy in me to
Yes.
say, okay, when I get home, I can give all my love. So it's kind of like a mini vacation away, but it's
Mm-hmm.
definitely still lonely when I am away. So it's a catch 22.
Yeah. Have you been able to enjoy any of your time? So, like, are you able to kind of schedule a flight in early and maybe go through the city while it's still daylight?
Yeah, so I just went to San Antonio. I
Okay.
live in Dallas, so it's not too far from me. But it was definitely good to just walk across the river walk. I'm actually going to California tomorrow, which is my first
Nice.
time ever going to California.
Ooh.
I did not imagine myself going to California by myself for the first time, but I definitely have some things planned for while I'm in California as well.
Oh, that is
So
so fun. Oh,
yes, I'm super
I'm so
excited.
happy for you. Look, the first time I went to California was because I was a CRA and it was for a visit, and just the entire atmosphere is so different. And I loved it. I was like, oh, if I could make more money, I could actually have a place here.
Right, right. There you go. There you go.
Okay, so we talked about kind of the things that you've gone through in transitioning. Do you have any advice for anyone who is an entry level CRA transitioning either from being a coordinator or just another role in clinical research? Do you have any advice to give to them?
I think my main advice would be to sit down and really think of a roadmap. Having that roadmap of just goals, it may not even necessarily be where you end up. However, if you have some type of navigation to just say, in the next 6 months, this is what I plan to do, or the next year, this is my goal. I think those are the first tools to success. If you write it down, you know where you're going.
Mm-hmm.
I think secondly is to ask questions.
Yes.
Get a mentor, figure out how to make yourself better. Will definitely help you get to your next steps of where you want to be.
Ugh, I love that advice. You're so
Yeah.
good. I can tell you're going to be an amazing CRA. Ooh, we're going to check in with each other. We are going to check in with each other once you
I can't
really get
wait.
into it.
I think I'm knee deep. I'm knee deep
You
right
in
now.
there now? Okay.
I'm in there. They just pushed me on in the water.
That
So
happens. You know, you have your CRC background, oncology, which is I consider one of the more challenging indications within clinical research. So at that point, it's kind of like, I think you know what you know.
and I want to say this too. I am so grateful. You guys say this all the time, trust the process. I really didn't understand that until now looking back. I used to be like, dang, I really want to be a CRA. I really want to be a CRA. I mean, yeah, CRA, but being in oncology and taking that time to really understand how to read a protocol, it's life-saving. Like it has kept me to not have to send 1,000 emails a day on understanding the protocol. So knowing those, how to actually read and interpret it has been life-changing. So
Yeah.
trust the process.
Thank you. Oh, Ashley, this was so good. Thank you so much for
You're
agreeing to
welcome.
this. You are such a huge part to me within Black women in clinical research, because you always provide insight. You're always like, this is what I did. You're very transparent in your process. I appreciate that. And I'm sure everyone who's a part of that group definitely appreciates that. Thank you for coming on. We'll catch up. We will definitely catch up.
Sounds good.
Thank you. Bye.
You're welcome. Bye.